Hello, this is Chomungaso Jovin, and I'm going to be taking you through the rag application that I created. And I basically created a rag application that was retrieving information about gestational diabetes. And this is what I came up with. So basically, RAG is a hybrid model that combines information retrieval and text generation to produce a precise and contextually relevant answers. So basically, RAG application, it helps us not to retrain the model once again, but instead we just provide that model with a database from which it retrieves information and it brings that information and it generates it. So the mechanism always includes two things, that is retrieval and the generation. So for retrieval, we are just retrieving relevant documents from the database that we provided to the model. Then generation is like we are synthesizing a coherent and contextually accurate response based on the retrieved what? Based on the retrieved information. And this was basically done by a model known as GPT 3.5 Turbo. And it was the one that was used to generate the responses. So for the corpus creation, I created a corpus from scrapping different PDFs about gestational diabetes, and there were around 20 PDFs. And after that corpus, I also got a corpus that was an Excel sheet that included information that was got by specialists or medical specialists, doctors and nurses that know more about gestational diabetes. So that's the way I created the two databases. And my model was my RAG to my LLM was retrieving from the two databases. So the tailored corpus ensures that the RAG applications provide accurate and reliable and specific information. Then for patients, it helps the pregnant women to quickly find relevant information about gestational diabetes. Then for healthcare providers, it assists healthcare provider professionals in assessing the latest research about gestational diabetes instead of relying on information that was provided a long time ago. So these are the related ones. Basically, people have not yet done RAG applications of gestational diabetes, but I reviewed some papers with people who did the RAG, but in the medical field, but in different what? In different areas. So there is those that done on nephrology. This is the study of the kidney. So they also built a RAG application to provide information about the whole kidney. Then those that use Llama, these were used to just predict or to in assisting the victims of sexual harassment to know how they can take care of themselves after being raped or being defiled by people. So basically, the limitations they go to are scalability, the risk of embedding biases present significant challenges, and necessitating meticulous prompts engineering to maintain the model's adaptability while safeguarding its efficiency. So the problem definition, basically, for me, the problem definition is that I want to produce a RAG or an application that provides okay, basically, there have been difficulties in navigating through vast amounts of scattered information station diagrams. So, and there is need for quick access to up-to-date and relevant information to make informed decisions during pregnancy. So that's why I'm creating this RAG application depending on this problem. And there's also lack of personalized information tailored to individual patients' needs and conditions. So you can find someone knows nothing about gestational diabetes, and the healthcare providers, they don't know recent information about the gestational diabetes disease. So that's why I'm coming up with this application in order to broaden their minds or to provide them with the latest information about gestational diabetes. So my objectives is to develop a RAG application that enhances the accessibility and the accuracy of information related to gestational diabetes thereby adding both patients and healthcare providers in managing the condition effectively. And some of my specific objectives is to enhance the clinical decision support by providing healthcare professionals with rapid access to the latest information about gestational diabetes, and to also provide patient education by delivering personalized education content to the pregnant women. Then this is my methodology. This is the way my model works. So basically, there is what we call the data sets. Those are the proprietary data. So we store those data sets into a vector database, but we first embed them, or we first assign them different numeric values before we store them into the vector database. So as the user inputs his query or his prompt, the query is also first embedded, and then we search the information relative to that query in the database, and we combine all that information to provide it to the LLM so that it can provide an answer to that particular question or query that a user asked. Then the collection and preparation, as I told you earlier on, that I created two databases. The one was a text document, which was bought by scrapping 20 PDFs. And another data set was an Excel sheet, which had 8 columns: the scenario, keyword, question, guidelines, target, guidelines, diabetes screening questions, misinformation and disinformation, addressing misinformation, and midwifery advice. So both the data sets were cleaned and they were converted into the lowercase, removing stop words, lamantizing. So we did all the processes of cleaning text data. So for the retrieval mechanism, as I explained, that the retrieval mechanism is going to be retrieving information from both the data sets, both the Excel sheet database and the text document database. So it retrieves the top documents, because before this data was stored, it was turned into different sentences that make meaning. So when a user asks a particular question, we retrieve information or sentences that are relevant to that particular question. So the model will retrieve from both the data sets, the top 3 data sets, and the top 3 sentences. Then it combines them and provides a response depending on the data from both the data sets. Then, as I told you earlier on, that we used the GPT 3.5 as the LLM in order to generate the response for the user. Then this is the architecture, as I told you, the text corpus and the Excel corpus. So they get they get top documents from both those two corpus, and then they add those documents. Then they provide those documents to the GPT-3, and it gives an answer or a response. So these are some of the visualization of the EDA of our data sets, whereby on my left, you can see the graph of the stopwords, and on my right, you can see the graph of the non-stop words. And here, these are the bigrams. So we used N to B 2, so these are bigrams. So on my left, I see a graph of the bigrams that were used most. On my right, you can clearly see a word cloud in the dataset. So these are my results: the exact match, the ECG, the invariance accuracy, and the inference time of my RAG application. And the benefits of my RAG applications are basically improved information access. It also enhances decision-making, collaboration, and communication. And then some of the challenges we face with our model limitation, you can find that the GPT 3.5 has some limitations. Then we also had some technical challenges and the data quality and reliability, since we just scrapped. So the quality of our data was really low. So for a future work, I would like to enhance the model by building a more user-friendly UI for the users. And maybe the database is also said to be improved and increased when more information about gestational diabetes is what. So conclusively, that is my rag application, and it was giving information about gestational diabetes, which is a disease that pregnant mothers get when they get a pregnancy. So these are my references. So thanks for watching this video. We meet again next time.